The way that the vaccine works is it briefly programs cells to produce a spike protein that then creates antibodies against the COVID virus, and only the COVID virus. There is absolutely no evidence in the literature that the antibodies to the spike protein cause any disruption or dysfunction of the placenta whatsoever. There's no increased risk of infertility, there's no increased risk of miscarriage. Those are all false rumors. It's a great question about considering the vaccine if a couple is going through fertility treatment, particularly around IVF. And I think the two questions people might want to consider is that one is, do I want to complete both vaccines before I initiate the IVF treatments? And second of all, how soon after I receive a vaccination is it safe for me to undergo some of the procedures such as egg retrieval or embryo transfer? And there is a transient fever that develops sometimes for the first 48 hours after a vaccine is given. And I think if I was going to give any advice to people, it would be not to undergo an egg retrieval or an embryo transfer during those first 48 hours after a vaccine. But other than that, it is entirely safe to use. It doesn't reduce the likelihood of success, and it doesn't lead to any malformations or miscarriage in the pregnancies.